Long QT syndrome is a congenital heart condition marked by a prolonged QT interval on electrocardiograms and a proclivity for ventricular tachyarrhythmias, which can cause syncope, cardiac arrest, or sudden death. Let's have a quick look.
LQTS is frequently discovered after a heart attack or other cardiac catastrophe. In some cases, this illness is discovered after a family member passes away unexpectedly. When an ECG indicates QT prolongation, it could be a long QT syndrome. Physical examination findings may not always imply a diagnosis of long QT syndrome, while some patients may have abnormal bradycardia for their age and hearing loss or congenital deafness, indicating the potential of Jervell and Lang-Nielsen syndrome. LQT7 or Anderson syndrome patients have skeletal abnormalities such as short stature and scoliosis, while LQT8 patients have congenital cardiac disorders, cognitive and behavioral issues, musculoskeletal ailments, and immunological dysfunction. It's impossible to say how common LQTS is. It is estimated to affect 1 in 2,000 or in some cases 1 in 5,000 people. Female patients, about 60 to 70% of them have more newly diagnosed cases of long QT syndrome than male patients. Long QT syndrome, LQTS, is an underdiagnosed condition, owing to the fact that some people with LQTS gene mutations have a normal QTc duration. Your doctor will perform a physical exam and ask questions about your or your child's symptoms, medical history, and family history to diagnose long QT syndrome. The most common test used to identify long QT syndrome is an ECG. A prolonged QT interval refers to an abnormality seen on an electrocardiogram. This abnormality reflects a disturbance in how your heart's bottom chambers, or ventricles, conduct electricity. Long QT syndrome is treated with a combination of lifestyle changes, medicines, and maybe surgery or other procedures. The treatment's purpose is to avoid irregular heartbeats and mortality. Based on your symptoms and the type of long QT syndrome you have, your doctor will discuss the best therapy choices with you. Stopping the medicine that is causing your symptoms may be all that is required to treat drug-induced long QT syndrome. But, you just can't stop the medication right away. Your doctor will be able to advise you on how to do so securely. Treatment of the underlying disease is required in other cases with acquired long QT syndrome. Treatment varies, but it may include intravenous administration of magnesium or other fluids to address electrolyte imbalances. Long QT syndrome is not curable, however medications can help prevent against potentially fatal cardiac rhythm alterations. Here are some of the medications for the treatment of long QT syndrome. First of all, beta blockers. Beta blockers are a type of medication that prevents the body. For most individuals with long QT syndrome, these cardiac medications constitute conventional treatment. They reduce the risk of long QT events by slowing the heart rate. The beta blockers nadolol and propranolol are used to treat long QT syndrome. Some brand names, which are most commonly used, includes Inderal LA, or Inopran XL. To learn more about beta blocker, watch our video on beta blocker therapy in our feed. One of the other drugs used in combination with beta blocker is Mexiletine. If you take this heart rhythm medication with a beta blocker, you may be able to lower your risk of fainting, seizures, and sudden death. Other long QT syndrome treatments that your doctor might consider for you, depending on your symptoms, include LCSD, which stands for Left Cardiac Sympathetic Denervation, and Cardioverter-Defibrillator Implantable or ICD.